Good morning, everyone. We're excited to present our project, the Lightstream Initiative by EcoSustain Solutions, as part of the Emory case competition. Our team has worked collaboratively to address critical challenges faced by underserved communities. Today, we'll walk you through our innovative approach to creating sustainable solutions that improve lives. Thank you for this opportunity, and let's dive right in. Meet Faisal, a young woman in a Rohingya refugee camp, home to 20,000 people. Clean water is scarce, leading to illness, and overcrowding makes safety a constant concern. At night, the lack of lighting leaves women and children vulnerable to danger. Our project aims to change this, providing clean water, sustainable energy, and a safer future for Faisal and her community. Communities today face two critical challenges: the lack of clean water and energy storages. Contaminated water leads to illnesses like cholera and typhoid, while poor sanitation worsens public health risks. Safe water and hygiene are vital for preventing disease. Energy storages create unsafe living conditions, leaving families in poorly lit, unstable environments. This increases vulnerability to crime and health issues. By addressing these issues, we can improve lives and build healthier, safer communities. Camps face critical challenges, and addressing these are essential for improving lives. First, providing clean water and hygiene education prevents disease and promote healthier communities. Second, introducing renewable energy like whirlpool energy system ensures electricity for lighting and essential needs. Next, enhancing security through lighting in safe spaces reduces violence against women, fostering safer environments. Lastly, raising awareness about HIV transmission and treatment empowers communities to reduce stigma and access care. These initiatives create safer, healthier, and more sustainable living conditions.
Our first solution will be the implementation of a whirlpool filtration system that will be built along the Nav River. Whirlpool turbines are already used in rural third world countries, and they harness electricity where one whirlpool can power up to 60 homes for 24 hours for 7 days. Given this, a pilot program will allow us to effectively build a couple whirlpools in one camp, which we have chosen to be Camp 25, given that it's the smallest camp in Cox's Bazar and it's very close to the Nav River. We will go in and we'll speak to the refugees of this camp to understand their unique needs and see if they're on board with the idea of using the electricity harness to power streetlights in the camp, chemically treat the water, and if there are any men in the community who are interested in being a part of the construction and the maintenance of the whirlpool system for compensation. The success of this pilot program will provide us with a clear idea if we can hopefully expand this program to larger camps in the future.
Whirlpool turbine. How it works. The process begins with water flowing naturally from a nearby stream or existing body of water. This ensures that the system operates sustainably without using any artificial water sources. The second step is the water enters a circular basin, and this is what controls the whirlpool. This control whirlpool spins a central turbine, effectively converting kinetic energy into mechanical energy. This step is key for generating renewable power. The third step is the turbine's mechanical energy powering a generator. This generator then produces electricity, and the electricity is going to be used to power streetlights and community facilities within the refugee camp. By lighting the streets and key areas, this will improve the safety and accessibility, especially in the night within the refugee camp. After the turbine generates electricity, the water is then moved directly into a filtration unit. This filter is made out of 3 units: the coarse filter, which is basically what removes the big, large debris like leaves and dirt, and then the sand layer, which captures smaller particles and sediments, and then the last layer, which is the activated charcoal layer. This is what eliminates the contaminants, odors, harmful bacteria, and once filtered, the clean water exits and is stored in a reservoir, which is used immediately for drinking, cooking, and sanitation. And any sort of fish that is collected within this filtration process is stored to the side.
We expect 3 outcomes from our first solution. Firstly, this electricity created by the whirlpool can be used by the community in any way that they see fit, and they can possibly use any leftover electricity to profit off of, and we will work with them to get things set up. This will provide them more independency from external electrical providers and promote a sustainable income stream. Additionally, the electricity will provide a continuous power to the streetlights at night to help with creating safer public areas and mitigating the high rates of violence in the camps, especially against women. Secondly, by purposeful volunteering, this can help improve the men's mental health while providing a space in the community for women to take on more roles, which can contribute to their empowerment and the community's overall health. Thirdly, a predicted outcome from the filtered water that will be chemically treated will be the cleaner ingestible water that will help prevent infections and overall reduce the burden of infectious diseases, especially on children who may have weaker immune systems.
Our proposed educational programs leverage culturally sensitive strategies to create meaningful impact. Currently, HIV prevention in refugee settings is often deprioritized with an immediate focus on survival needs, creating a gap which exacerbates stigma and misinformation. Firstly, we plan to focus on reproductive health workshops led by both men and women to ensure inclusivity. This will be complemented by testimonials and materials intricately designed to resonate with the audience, driving both awareness and action. The program aims to holistically improve hygiene and overall refugee communities. Improved sanitation achieved by pairing water access initiatives with essential health programs will address food security education, tying it to nighttime safety enhanced by whirlpool turbine-powered lighting solutions. Additionally, peer education will encourage community leaders to drive change over generations, bringing long-term sustainable health improvements and community, more specifically women, empowerment to the refugee camps. While implementing these programs, we recognize there will be key barriers and proactively aim to solve them. First, limited access to education has historically prioritized survival over preventative measures. We propose educational campaigns delivered by trained and trusted community representatives and amplified through radio broadcasts, a proven method for mass reach. Next, cultural barriers like the stigma surrounding reproductive and physical health are compounded with language concerns, as Rohingya refugees primarily speak Rohingya and Burmese. This language barrier further excludes the general population from understanding HIV education through a religious lens. We address these by integrating Islamic health beliefs into our education programs and involving trusted leaders like imams or women representatives to facilitate culturally relevant, effective communication. These teachings will support that HIV and waterborne disease education resonates with the community values. Materials will be adapted into Rohingya and Arabic, supported by visual aids that combine cultural and scientific knowledge. Finally, to close structural gaps, we will establish continuous collaborations with stakeholders such as the UN and local NGOs, ensuring that sexual health education seamlessly integrates into daily routines. Workshops developed to address HIV education alongside hygiene and nutrition enhanced by the Whirlpool turbine will link the impact of filtered water in preventing infections and emphasize the importance of overall health and awareness. To bring this vision to life, local Bangladeshi NGOs such as BRAC and Friendship provide on-the-ground expertise and logistical support, leveraging their existing programs in health and education within the Rohingya camps. Community members included trusted Rohingya leaders, imams, and women's groups like the Rohingya Women's Empowerment Initiative ensure that our programs are culturally accepted and locally led. Finally, technical partners such as UNICEF and UNHCR provide specialized expertise in water sanitation, health education, and disaster resilience, enabling scalable, high-impact innovations and inventions.
Goals of 50% reduction in waterborne diseases and cleaner drinking water for 90% of the residents will be monitored through monthly water testing and infection rate comparisons. Confidential self-report surveys at multiple time points will be used to measure the goal of 25 to 30% reduction in gender-based violence and HIV prevention. This will be evaluated by measuring vitals and workshop attendance at 6-month intervals.
Our 4-year plan consists of 3 stages, which are community engagement, execution, and evaluation. The first 3 months will be reserved for speaking with refugee camps and then designing our solutions to be relevant to the communities. The construction of the whirlpool filtration systems will take around 1 year and should be in operation after 1.5 years from the start of our project. The streetlights will only need around 3 months to set up and will start running around the same time the whirlpool is completed. Also, the education plan will be distributed only 6 months and will be monitored for another 3 years. We will evaluate the effectiveness of our solutions by measuring qualitative and quantitative data, pre-implementation of our solutions, and then again, post-implementation.
Let's take a look at the financial breakdown for the 2 projects. So with regard to the whirlpool and filtration system to provide the clean water, we've allocated 2/3 of the total budget, and then we're putting the remaining $2 million towards the education plan. So baked into the wind turbine cost breakdown, we've budgeted a significant portion of capital towards materials. So that's specifically on the turbines, water filtration devices, and street lighting systems, which will be spent on a rolling basis in congruence with the annual payments that we will receive. We plan to spend the remaining money on human capital and implementation, saving $710,000 for any maintenance fees that may come up in the future years. So now moving on to the education plan program, we budgeted a significant portion on the radio broadcasting messaging to spread the health media as widely as possible. This is the form of information that is highly consumable in many refugee camps, so that's why we've chosen this strategy. We've also considered the significant investments in personnel that would facilitate the learning and also create the media. So other costs include education materials and preventative HIV contraceptives. We've also saved 10% of the budget to be used towards any emergency funding so that we can mitigate future risks, which we'll break down in the next slide.
On to the risks. One of the main risks is flooding. Flooding can damage the filtration system, but to prevent this, we propose building raised platforms made from local materials like bamboo or concrete and providing clean water kits during disruptions. The second risk is limited access for women. There may be social restrictions that may limit women to access some of these water points. Safe collection areas in collaboration with community leaders such as imams or elders will ensure inclusivity. The third risk is feasibility in lower water camps. So camps without strong water flow may face challenges. We suggest in these situations to use water wheels instead of turbines to generate electricity for streetlights and improving safety in the night, so the overall goal is maintained.